Hi, this is Dr. Donald Pelto. These are the instruments that are used for this procedure. It includes a 18 gauge needle and some gauze that's going to be used. And here's a picture of the hammer toe that we're fixing here with this procedure. So enjoy. Hi, this is Dr. Donald Pelto. I have a patient here. She has a toe that's actually curved over, and it needs to be straightened out because it's creating all this callus tissue on the tip. And so the first aspect of treating this, we have to trim off the excess callus with a 15 blade. This is just a blade. You shouldn't do this on your own at home. And the reason all this callus is building up is because the toe is curved down or hammered, and it's creating this ulcer on the tip of the toe. And so what we're going to do today is we have already numbed up the toe, and the reason it's orange is because I just put some iodine on there to clean up the toe, and we're going to straighten out this toe. So if you see this little ulcer on the tip of it, and if you look at the toe, I can straighten this toe out with my finger, so that's called a flexible hammer toe. If it was rigid, or if I couldn't straighten it, then this wouldn't work. But this is an ideal procedure for someone that has a flexible toe, and we want to straighten it out and hold it in this straightened position. And what we do is we find an area right on the bottom of the toe, and I use a 18 gauge needle. And what I do is I just find kind of at the sulcus right here at this line, and I've already numbed up the patient, and I go in with the needle and I make a swiping motion with the cutting portion of the needle. So I enter in. You kind of find out where the tendon is. I feel both sides of the tendon, and then I cut. You can hear that as the tendon is being cut, and then you see it straighten. And then if you could just push down your toes, cramp your toes down like that, and it's tilting down a little bit, so I need to cut a little bit more. And then you see how the toe is much straighter than the other toes. And now comes the important part, is we have to clean off this. And now I need to kind of splint the toe in the straightened position so it doesn't curve back down. So I've kind of cut the tendon. And so what I do is I take some gauze and I kind of make a roll, a ball of it in here, and that's going to go on the bottom of both of these toes, kind of straightening them. And then on the tip where the ulcer was, I have a little piece of gauze where I have some iodine on it, some betadine, and it's going to kind of go up like this. And that's going to help that toe covering the ulcer and help straightening it out. And then I have some Coban right here, and this is going to help me to hold it in the proper position. And then typically I'll see these patients back in about 3 or 4 days just to make sure that it's doing okay.
Should I keep it dry?
Yep, keep it dry till you see me in about 3 days.
You'll have to speak
Yep,
louder.
keep it dry for 3 days. Yep. And there it's nice and straight, and that will heal up there. Thank you.